This is a kneeling thoracic rotation drill with a foam roller here. So show the technique and then I'll break it down. So I'm taking this foam roller and I can hold it in a couple of ways. One is I can hold it in an underhand grip. The other is I can gently hold hands on the side. And then I'm kneeling just on one knee. The forward leg, I'm going to rotate to that direction by trying to draw the edge of the foam roller backwards. I can incorporate some breathing. So I'm going to exhale as I turn and come back. Okay. So what we have going on here is we're trying to work on isolated thoracic and shoulder rotation without low back rotation, something weird going on the shoulder, or shrugging up into our neck. So what I mean is a rotational, where a lot of our rotation of the body comes from is from the hips and from the shoulder and the thoracic spine. Often we can have some difficulties turning through the mid and upper back. People end up compensating by turning into their low back, and that sometimes is uncomfortable or just not the best strategy. And so we're trying to find a way to encourage motion and get a feel for that, but in a position that is hopefully going to set us up for success. So in this kneeling position, when I turn towards that front leg, it makes it a little harder, not impossible, but a little harder to rotate through the low back. And then when I have this roller, just kind of giving it a nice little hug here, I'm going to turn, and it makes it a little harder, again, not impossible, but a little harder to shrug up to my neck or to do something weird at the front of my shoulder. Okay? This still is going to take some focused practice if this is new to you, meaning I want you to focus on where you feel this. Sometimes eyes closed if you're comfortable. And so I want to feel this kind of behind my shoulder blade, not in my lower back or my neck. So I'm going nice and slow. If you feel it in your lower back, sometimes doing an exhale before you start to bring the rib cage down and a little core engagement kind of low here. So I'm going to hold that. And now I'm going to rotate, and that's going to help to prevent me rotating into my lower back. If you feel it in your neck, a lot of times we just start shrugged up, and then I turn, I'm kind of restricted. And so again, exhale, let it all go. We're going to let all that tension go at first, and then let the shoulders come here, and then I'll try to turn. You can experiment with different grips. So elbows in tight, just nice and soft here at the chest. But I want to turn and not let my elbows flare out. I'm not trying to bring this roller away from the body. I'm just using this to guide rotation without shrugging up and without arching the low back. So a little brace at the core, using the roller to help me to turn. And if you're a little tight here, it's not going to feel like a lot of motion, but all I'm looking for is a couple degrees of turn without the low back turning and without that shrug up into the neck. We typically see often, as I'm starting to teach this, is there's techniques with a straight arm, and people come and their arm goes like this. So the palm rotates down, shoulder comes up and forward. That can be uncomfortable here or uncomfortable at the neck. Or I turn and I just arch and extend my low back, potentially uncomfortable there. Sometimes we'll come to the chest, but even that can lead to kind of this position at the elbow. So I'm kind of trying to take away a lot of those variables. And I found just this roller drill, no matter how you hold it, as long as your elbows are in pretty close to the body, it's a little harder to have any of those compensations as long as we're controlling for the low back position. So give that a shot. And I would, of course, do both sides. But I'm trying to think as I turn, I'm almost trying to draw my shoulder blade on the side I'm turning to, trying to pull this roller back and allow things to spin without arching back or shrugging up. So thoracic rotation, that can be tricky to feel, but give this one a shot. And if you don't feel it feels like the right things at first, just be patient with it. Don't go into pain or force anything, but just trying to get a little bit of motion above the low back and below the neck without shrugging up or sending the shoulders forward. So give it a try and be patient. And often coming back to it various times, as long as it's not painful, can help to really iron out this movement pattern.